Hello, and thank you for joining us for the next episode of the Data Monetization webinar series. This episode will examine data monetization in medical devices, healthcare, and insurance. This is the second episode in a 6-part series, which will take place every other Thursday through mid-December. A recording of the webinar and the slides will be made available to all registrants. Feel free to enter any questions using the Q&A feature in the Zoom menu. And we invite you to follow us on LinkedIn to see news about other upcoming webinars. And with that, I'll turn things over to our moderators.
Thank you, Michelle, and welcome everyone to our program today. It's been a couple weeks since our first inaugural program in our data monetization series, which was the brainchild of Suneel Arora, one of our panelists today. So Suneel, let's just start out with Suneel for the introduction. Suneel's a partner at the Schwegman, Lundberg, Worcester law firm. Suneel spent his entire career specializing in IP, subsequent to his engineering days at Boston Scientific. Suneel's primary practice area is in med tech, but also is heavily involved in semiconductor protection as well as works for a variety of other technology companies, but has a special interest in med tech. So today's program is right up his alley. Suneel's partner at the firm, if I didn't mention that before. So our panelists today, our guest panelists today, we've got 3 terrific panelists that are right up the alley of medtech data monetization. The first one I'm going to introduce is Jote Taddese, and Jote is a seasoned IT executive and social entrepreneur. He's currently the VP of Engineering at Rally Health, a US-based consumer-centric digital health company that makes it easy for individuals to take charge of their health and collaborates with health plans, healthcare providers, and employers to engage consumers. He's also the past president and current executive board director of Books for Africa, the world's largest shipper of text and library books reaching all the 55 African countries. He's also a co-founder of Diaspo Care LLC, a digital healthcare platform that connects the African diaspora to the pharmacists and clinicians back in their home countries. Jote was born and raised in Oromia, Ethiopia. Did I get that right? Jote, correct me please, because I didn't practice that one. You got
it right.
Okay. And he was educated in Nairobi, Kenya, and the US. He has over 20 years working with customer-centric IT as a customer-centric IT executive. So our next panelist, and welcome Jote to the panel, and thanks for joining us today. Our next panelist I'll introduce is Liz Fortier. Liz is currently the privacy officer at LivaNova, which is a healthcare company. Liz is an attorney who has extensive experience acting as general counsel and data privacy officer at a number of high technology companies, many of them here in the Twin Cities. She was formerly with Lucid LLC, which I think is that a Florida company, Liz? I forget.
It's they were started in New Orleans. Actually, they're kind of in the digital innovation sort of data monetization space.
Yes, I knew it was somewhere warmer than Minnesota.
Mm-hmm.
So sorry about that. And she was formerly with Code 42. It's a burgeoning company here in the Twin Cities that basically does data storage and backup. And then also chief legal officer and secretary at Syncada, and also was at High Jump Software for a number of years. So Liz has got a lot of practical experience with data and monetizing data and how to protect that. And she's got a tremendous few slides to share today to help everyone get up to speed. And last but not least, we've got Manjeet Rege, who's an associate professor and director for the Center for Applied Artificial Intelligence at the University of St. Thomas. Dr. Rege is an author, mentor, thought leader, and frequent public speaker on big data, machine learning, artificial intelligence technologies. And he's also the co-host of the All Things Data podcast. that brings together leading data scientists, technologists, business model experts, and futurists to discuss strategies to utilize, harness, and deploy data science, data-driven strategies, and enable digital transformation. And I've just about ran out of breath on that one, Manjeet.
Thank you.
Anyways, Manjeet is a brilliant guy, and we're really looking forward to the presentation today. So with that, without further ado, I'm going to roll it over to Manjeet to kick this thing off.
Great. Thank you, Steve. So in our webinar today, I'll start off initially talking about the growth of healthcare data and the fact that data in healthcare has been stored for a while now. And that has kind of resulted in this question about how do companies monetize this data. Different models of monetization is something that Jote will be talking about. And then while companies are on this endeavor for monetization, they have to also pay attention to consumer privacy and security. And that is what Liz will be getting into. So next slide, please. So storing healthcare data and patient data is not new. It has been done for a number of years. Um, for applications such as identification of health trends and epidemics at a regional or a national level, it is important for policymakers to be informed of health trends so that they can be better informed when making decisions. Tracking of vaccinations of individuals in an attempt to reduce the heavy burden of disease is a common strategy in both developed and developing countries. Targeting of health research efforts and interventions, again for research studies by governments and aid institutions are very common. And maybe one of the most important uses for health data on a larger scale is allocation and distribution of healthcare resources. Data can be used to better inform decision making and for improving health outcomes in communities. Now, in recent times, there has been a data boom in healthcare. Earlier, healthcare data was in the form of paper records. And healthcare providers and payers had no means to really use and monetize it. But now with digital revolution in healthcare due to the use of electronic health records, wearables, sensors, mobile applications, all of this has increased healthcare data. So the amount of global healthcare data has increased significantly. Just to give some estimates here, in 2013, the global healthcare data was 153 exabytes. And just to give you a reference, 1 exabyte is equal to 1 billion gigabytes, right? 1 billion with a B. And we are expected to generate around 2,314 exabytes of new healthcare data just this year. So digital adoption has exponentially increased the use of healthcare data, and organizations have started valuing it as an asset. Insights derived from data can improve treatment options, personalize medicine, and help achieve value-based care. Um, Now, in our last webinar, we introduced this concept of internal and external monetization. Um, so again, how does it apply to healthcare? So when we refer to indirect or internal monetization, that encompasses the ways data can impact revenues without the data ever leaving the organization. Um, so using data to enhance offerings, introducing new offerings, or to improve operational performance are examples of internal or indirect monetizations. One example of a internal monetization or an indirect monetization is reduction of wait times at hospitals and clinics. So as a result, you can have more patient volumes being seen, and there have been studies where patients saw reduction in around 38% in their wait times, meaning that their healthcare delivery was both more efficient and it allowed those individuals to return to their daily jobs or roles as caregivers, for example. Now, direct or external monetization is fraught with complexity and controversy, I would say. And it is happening all around us, and big dollars are at stake. Um, One example of a direct monetization is bartering or trading data in return for performance benchmarking or data enrichment services such as registry. So this is a common practice in healthcare. Um, and I'll, over the next few slides, I'll go over examples of how different healthcare enterprises have tried to monetize. Pittsburgh based integrated health system, Highmark Health, had created this internal innovation program called Vital to use organizations' resources as a way to test FDA approved technologies internally. Now, they have access to claims data from Highmark Health Plan, and they have around 4.5 million members from a number of states. Now, what they did was Highmark commercialized this internal program in an effort to boost innovation across the industry, um, and as a result, also opened up a new revenue stream for itself. So the hope is that startups looking to gain real world evidence of their technology will pay to get access to this data that they have. The next one is Mercy Health, based in St. Louis, Missouri, launched a real world evidence network that pools clinical data from health systems across the country. And so this database, I believe, is in partnership with one of the leading IT companies, is used for advanced analytics, allowing providers to extract more comprehensive insights that can lead to improvements in patient care. But this nationwide database is built upon Mercy's existing real world evidence network, which analyzes millions of health systems, patients' records, and so on and so forth. So, apart from the providers who supply the de identified patient information to the new network, outside parties such as healthcare regulatory bodies and drug and device makers who will be subscribing to this network will also have access to curated data sets that address specific queries rather than to the entire database. And one more thing that they have here is that they will also be able to, so people who will be subscribing to this database will also be able to contact affiliated researchers who can then help put those data sets in context. It's not as if a lot of data is just thrown at you. You also have a service being provided to make sense of that. My next example is about this recent agreement between GlaxoSmithKline and 23andMe for healthcare data monetization. Now, although this is being promoted as a collaborative use of genetic data that 23andMe has access to, many have kind of concluded that the data was sold to a high bidder, Now, in the agreement, GSK invests 300 million in 23andMe in exchange for access to the genetic information of its 5 million customers, with the goal of accelerating treatments and cures. So there is no doubt that the potential scientific value of genetic data is significant, particularly at such a scale. But there are also questions that this leads to. Um, if so much information about consumers and genetic information is being shared, um, should the profits be also be shared with the contributors of that genetic information? And that is the idea behind this new effort at Stanford University. So this initiative is a new approach to training artificial intelligence algorithms by paying people to submit their medical data and then storing it in a blockchain protected system. So this is a secure way for patients to share their data with researchers, and it relies on cloud computing, and it is designed so that researchers never actually see the data, but it directly gets fed into an AI algorithm. Now, this data sharing design has implications well beyond healthcare. In California, the governor of California has proposed a data dividend approach that would transfer wealth from the state's tech firms, whether it is infotech, whether it is medtech, to its residents. Um, and now that would require firms to put a price tag on each user's personal data. So the approach rests on a growing belief that the tech industry's power is rooted in its vast stores of user data, and these initiatives would upset the current system that we have, where larger the amount of data you have, bigger you are and richer you are. So this is something that is up and coming up. With that, I'll hand over to our next speaker, and that is Jote.
Thanks, Manjeet. That was excellent.
Excellent. Thank you, Manjeet. And I just want to say thank you to everyone. It's wonderful to be part of this forum. So I'm going to take you through kind of based on what Manjeet has set up as a context, starting with, what is the motivation behind monetizing data? Why do companies want to monetize data in the first place? So in this page, really touching on some of the obvious business reasons and drivers. We've all heard about this terminology around business transformation or digital transformation. So traditional pipeline companies investing heavily on their effort to transform their business models and incorporate digital means of reaching their customers. For example, in the medical technology space, especially med device manufacturers are really starting to pivot from designing, developing, and manufacturing implantable and wearable devices towards more of delivering new solutions and services and therapies through digital means. Also, there are both established and startup companies that are looking to create new revenue streams or supplemental revenue streams by monetizing data. And also there are now, it's becoming very obvious for a lot of companies to introduce new lines of businesses that are based on specializing in digital analytics and delivering specific data products, so to speak. And then there are also companies that are looking to monetize data to strengthen their partnerships with their partners across the ecosystem, suppliers, distributors, and so forth. In the healthcare space, it's more around the payers, providers that are now incentivizing the need for monetizing data. Improving corporate valuation, startups, for example, and again, there's a big hype around, even in the investors community, where when a startup company has specific expertise around data analytics and creating machine learning algorithms, predictive analytics, and specific recommendations around healthcare outcomes, that tends to drive the valuation and tends to attract investors as well. And for those that are established, of course, increasing the shareholder value by really harnessing economic value from the data is another motivation as well. And also now within the digital health space, enabling better consumer experience by engaging directly with individuals through digital means and through harnessing data, and also using that data to gain better insights to their customers, their needs, their behaviors. That tends to also drive the incentive for data monetization. And finally, of course, any company, especially for-profit company that's out there, revenue growth is one of the key objectives, and also attracting repeat customers by providing personalized and tailored services, which increase the lifetime value of healthcare consumer in this case, and being able to cross-sell digital products across multiple channels. So these are just a sample set of examples of why companies are investing in data monetization initiatives. And then in the next slide, so within the healthcare space, what are some of the data sources? And what you see here are kind of the usual suspects in a way, data sources where a person or a patient reported data, for example, is a source of healthcare data through surveys and forms that all of us actually at one time or more have completed healthcare surveys or forms, either online or when we go to the hospitals. That is, healthcare related data that's being collected. Data that is collected at a point of care, where we go to hospitals for appointments or call centers of either insurance companies or hospitals or any community health centers and pharmacies that we visit. Those are various points of data collection, and again, those data collected at various points, especially if tied to our identity, continues to grow in terms of the attributes and the dimension of the data that is collected about our healthcare status. And then, of course, there is data that is generated by the devices that we either purchase for our wellness tracking, in this case, such as Fitbit, Apple Watch. And also there are devices that are connected to us when we are at a hospital, such as bedside monitors. And again, those are points of data collection. And then, of course, the traditional, implantable devices like pacemakers, insulin pumps, that generate an enormous amount of data. And so really this is, as you can see, having a longitudinal view of a person or a patient by aggregated data that is collected at the various points of the wellness journey of a person really provides that a complete view of the person, which elevates the value, the economic value of that data as well. So in the next slide, we'll look at what are the ways of monetization. Manjeet has kind of touched on it at the very beginning. One of the perceptions out there when it comes to data monetization, the ability to sell data and make money, people tend to automatically assume data monetization with kind of a hard cash or currency exchange, right? And Manjeet has touched on this. Really, there are direct and indirect monetizations that create economic value for various companies. And of course, for a company that has multi-dimensional partnerships, and the ability to really exchange various information and trading information between partners without really exchanging hard currency. That's a way of monetizing. And also, there are companies, especially startups, that are specializing in data enhanced products or services. In this case, they could be wellness products from a healthcare standpoint, and also products that come with recommendation engines. So basically, based on historical data collected, there are various apps, both mobile and web apps, that are starting to provide tailored and personalized recommendations that drive people's behaviors. So this is really beginning to level set the playing ground when it comes to market entry, especially for startups. And I'll touch on it a little bit later when it comes to, especially for medical device startups, how the product design and product architecture actually needs to be rethought in terms of how the data will be structured and collected and processed. Of course, one of the other direct monetization methods is really, selling raw data, unfiltered, unprocessed data through established data brokers. And I think, especially within the last few years, there are companies that have adapted the entire business model based on collecting, aggregating, enriching, and monetizing public data, right? And that has become actually a pretty lucrative business model, and that has accelerated the valuations of startups in a short amount of time. And there are also companies who specialize in again, using public and enterprise data, developing very specialized reports, KPIs, and dashboards that are based on subscriptions to various companies who actually depend. These are market data, market research data, sales data that companies depend on to do some of their forecasting for their budgets, market forecasting as well, even investment prioritization as well. And then lastly, there are also companies that specialize in providing specific and specialized analytic services derived from data, from healthcare data. And within the predictive analytics space, one of the ways that various algorithms are developed is really by training algorithms on a large set of data. So, and algorithms that are trained to provide specific types of predictions and recommendations for consumers are trained, on a large set of raw data and multidimensional data, both public, enterprise, and social data that's being aggregated together. And then there are companies actually who base their entire business model in offering analytics products as well. Now, next slide, we'll look at some of the indirect monetization. So, of course, Manjeet has touched on this. There is a saying that says, a company can be data rich but information poor. What does that really mean? Well, it's one thing to accumulate an enormous amount of data, but if we do not know or have any context about the business value of that data, there isn't a whole lot that we can do. That's what information gives us. So the data is kind of provides us with the content, but the information gives us the context. So there are companies that are using especially medical device produced data and harnessing value by applying various types of processing and analyzing the data, and therefore use it to improve efficiencies, internal efficiencies within the boundaries of the company itself. And then again, this is around providing better healthcare services, driving enhanced healthcare outcomes as well. There are companies also, especially in the startup space, that I've seen this especially growing within the last few years, where companies actually use specialized data products and analytics services that reduce healthcare risks, that help people to avoid costly encounters by providing preventative health screenings, recommendations, and then wellness checks. These are all wellness, and there's one thing about managing illness and discipline and the process that goes around it when it comes to the data management disciplines. And then there's another thing also when it comes to managing wellness in terms of how to harness and process and actually analyze that data. So there are companies that are providing specialized solutions and services around that. Of course, developing new products and bringing it to creating an entirely new market out of data monetization that we've seen grow within the healthcare industry. There are companies that actually purely develop algorithms that provide predictive insights. There are companies that produce tailored KPIs and dashboards that big established companies are interested in, again, for their internal processes. Of course, building and solidifying customer and partner relationships, and this is indirect way of monetizing their internal data that companies have used. And so, in the healthcare space, this I have seen it both by medical device companies, insurance companies as well, where companies actually provide raw data to their partners, to their strategic partners, such as clinical trial centers, research centers, to develop new therapies, to develop new products that they can co-create, co-innovate, and then of course monetize it and share that cost and share the risk that comes with it as well. Let's go to the next slide. All right, so data monetization, I think it's kind of sometimes loosely understood concept because it comes it sounds kind of easy to do that because data is all over the place. Data is all around us. You know, our Fitbits and our Apple Watch and our phones, you know, every electronic device that we interact with produces data that is specific to us. It's about us, right? So earlier I said when it comes to the medical device space, especially for up and coming startups, this is something to really carefully design and consider the product design, the product architecture in terms of what is the type of data that is produced by this device, and how can it be identified, and how can it be collected easily. So traditional medical device, implantable medical devices, like I said earlier, it's been all about instrumentation, right? And lots of ones and zeros that require special interpretation by specially skilled people, right? And so that could be a hindrance if we cannot easily identify and easily collect that data. Will be hard to process it. Also, ease of developing consumable data products. So again, this is where for startups to consider, especially getting into the medical device space, making data that is easily understandable with consideration for security and privacy as well. And then it may be perfectly okay from a legal perspective to use that data to monetize it. But it is also very important to think about, even though it is legal, it is really ethical. Is it ethical to use that data? Is, I think, one of the questions we should be asking ourselves as professionals in this space. So hopefully this is some useful nuggets, but of course I can be reachable offline for any further questions. I'd like to turn it over to my colleague, Liz Fortier, for the next session.
Thanks, Jote. That was excellent.
Well, thanks for that segue. I have 3 slides and maybe just 3 sort of general points to make. So this slide is around developing a framework. And so this could be for startup organizations important, and even for more mature organizations, because we have startup companies wanting to create, innovate new products to collect and monetize data. We also have more mature organizations who find themselves in a position that they've been collecting vast information stockpiles without a lot of thoughtful planning, and then wondering what to do with all this data. And so I always say the important piece, particularly with a lot of the new privacy laws that are emerging, it's really important, and I emphasize, to develop a framework. And I don't know if that seems simple or complicated, but it's really important, because a lot of the decisions coming out, you know, for example, the Google decision, laws like GDPR, appearing to be compliant these days is not enough, right? You have to be able to document your compliance. And so being able to document a framework is really important. And so I won't, you know, a lot of the principles here on the slide are taken from GDPR, quite frankly, and other laws. A few that I would touch on, the first would be data flow and asset mapping. And this supports what we've been hearing today, which is really to be able to understand the source of your data, what are the data elements, what are you doing with that data, how is it flowing across your enterprise, through your systems, are you sharing that data with anyone, and to be able to document those flows. Right, you can do that in spreadsheets, which certainly is simple, but is often not scalable. I will also tell you that there are tools out there for startup companies who are saying, look, I don't have a privacy department. I don't know how to manage this internally. There are some great third-party tools out there that can help you do this sort of asset mapping exercise, which really becomes the foundation of your framework. It's really, and the sooner you do that in the life cycle of your business, I will tell you, the better positioned you will be. The other one I would point out is from a privacy by design standpoint, since we probably have some tech folks on the line, I know that we have developers probably on the line who are involved in producing new and exciting devices in the Internet of Things. And I think, and the laws suggest that we have a duty to build those devices, applications, platforms, cloud structures, whatever it is you're building out there for your healthcare companies, to do so ensuring that you're complying with basic security and privacy controls. And so again, embedding those privacy by design principles early into your product development life cycles, the better you're going to be. And again, document, right? So if you get anything from this slide, it's document your processes, document your framework. The second to last bullet, vendor management. Why is this important? You've heard it was sort of alluded to in some of the other slides, but again, if there's an interest in monetizing your data, oftentimes that happens by monetizing by reselling to third parties, sharing for consideration with third parties. And what I will tell you is that there are laws out there, for example, CCPA out of California, that start to say you have enhanced duties as a company if you're reselling your data, and enhanced obligations and things you're supposed to be doing on your website. You're supposed to be telling folks if you're reselling data. So it becomes really important to understand to whom you're sharing your data, to understand how it's being used, to then understand what duties you may have related to that act of reselling. And again, right, you may think that the party you're sharing it with isn't doing anything with it, but I will tell you, in the world of data, you then could have that vendor sharing it with another third-party aggregator who's doing something with it. So it becomes really important to understand the entire supply chain and mapping of your data, because, right, just because if you share it with one party, right, you can also have liabilities and duties related to what happens downstream, even if you don't know where it's flowing. Finally, on training, it's last on the list, but not last because it's least important. I hear regulators and often investigators here in the US saying training, right, again, in the spirit of documenting your framework, the easiest way of sort of detecting how committed a company is to documenting its framework is to look at their training programs, right? Do you have documented training programs to ensure that data privacy in your healthcare organization company, can you show documented training, right? So not only just in a privacy capacity, but do you have training for your software developers to ensure that they truly are embedding privacy by design? Do you have training to ensure you are doing privacy impact assessments? Do you have training programs in your procurement organizations and you get it. But so I emphasize training. So the next slide. So document your framework. The second one is, what are the rules that apply to your organization? And what are the rules to evidence that you do have a commitment to compliance? And I think it was Jote who was talking about the data source. I think this is really important for healthcare organizations. I'm at a medical device company, and the data, what is the data source? You can be receiving data from providers, through clinical trials, from the patients directly, from the caregivers. You could have patients who are minors. You could be receiving it from third-party aggregators because you want some insight related to how to develop your products. Why that's important is because the data source, the origin of that data, is going to also dictate and determine what laws apply, right? So the laws that might apply to receiving data from a provider could be different from the laws that would apply if you're receiving the data direct from your patient. So that becomes important. The other thing I would highlight is that, given we're talking about healthcare companies, the privacy laws in general talk about personally identifiable information. The laws talk about that in different ways, right? So some laws refer to it as personal data, PII, PHI, depending on the rule. What is certainly a generalization is I can make is that when we're talking about health information, it's an enhanced kind of personal information. So generally speaking, under the rules, health information is sort of a sensitive data type, and you tend to have incremental or enhanced duties when you're actually collecting the data, that type of data. So understanding, again, what type of data you're collecting, having a framework, and understanding the data source becomes really important. Again, I would also probably, it's not just the laws, I think, that are important to understand, it's also the standards you're applying, right? So what sort of, so for example, under HIPAA, you have to do gap assessments, and what are the privacy and the technical security standards that you're going to be applying to do that type of gap assessment? So what are the rules that are being applied? The other point I would make on this slide is just, I see this in companies all the time. Folks come to me and say, Liz, we already have this data in Salesforce, or we already have that data in this database, right? Don't worry about it, right? We have it. We have it, so now we can go use it. And I always have to counsel folks, right? Just because we possess the data doesn't mean that we lawfully obtain that data, or that we're entitled to use it in the way you want to use it, right? So again, what are the rules that you're applying? Because just because you have it, right, doesn't mean you can use it, right? Because I often get folks coming to me saying, well, we're going to go pull data from Salesforce and from Marketo, and then we also want to go reach into a quality server and we want to aggregate all this data, and then we're going to go do something with it. And so again, if you go back to our framework slide, understanding, right, what data you have, what's your framework, what are the rules that are being applied, because then you have to go use that in real life to go have sort of meaningful conversations with your business as to can you really go do what they want to go do with the data. The final point I'd make on this slide is just, again, getting your data house in order. The sooner you do this, the better, right? So I know oftentimes, so I've worked for smaller companies as well, and I know sometimes, right, there's this urgency to go build product, just go innovate. We just need to get something out the door, and we sort of don't want to deal with the data house piece of it until later, right? We'll deal with that later. And I will tell you, I've also been at large companies where I'm trying to also get our data house in order for larger companies. And it's more difficult to do that within mature organizations than it is within smaller organizations. So I always say the sooner you can do some of this, the better off you're going to be, because it really is about injecting data compliance into the DNA of your company. It's really important. And again, being able to document and demonstrate that. So the final slide I have for folks is sort of, right, we have framework, what are the rules and standards that apply, and also thinking about ethical considerations. And, there's not necessarily any laws that I could necessarily point to on this, although certainly there are duties out there for transparency and accountability. But really, I think this is an interesting one, particularly for US companies, because historically, US has been very sort of sectoral as it sort of comes to data privacy, right? We have laws certainly in the healthcare industry around HIPAA, so we're used to HIPAA, but we now are sort of starting to think about protecting consumers and patients to drive transparency and accountability. And there's also there's always kind of this tension between innovating and wanting to do things fast, and also, right, what's in it for the company, but what's the right thing to do. I think this notion of anonymization, if I was to comment on anything, the first bullet here about what's private and what truly is anonymization. I have folks come to me often and say, oh, Liz, don't worry. You know, that data set we've anonymized, we've synonymized that data set, don't worry. And I often say, but have we really anonymized? Right? We use that word, but have we really, right? Can you, right, to truly be anonymizing, right, processing must be irreversible, right? You can't have any singling out of an individual. There can't be any linkability between records relating to an individual. There can't be any inferences that should be made. And so I would encourage folks, as you're thinking about ethical considerations, truly, how are you approaching anonymization in your organizations? I think the last point I would share is that we are starting to see a trend, you know, for example, with the FTC and some of the regulators in the EU, certainly, where ethics is becoming part of what they're looking at is their investigations, right? Because there's sort of an increasing focus on ensuring that companies are doing right in their efforts to in data monetization. So I think with that, given time, I will conclude.
Thanks, Liz. And Suneel, I know you had at least one or two follow-up questions, one for Liz in particular, and then we've got another question that we'll take after that.
Yeah, so thanks, Steve. I mean, I do have a few follow-up questions, and I think in terms of ownership and privacy, I think one question that comes up from startup clients is, you know, how do we take ownership of the data, and you know, what's the framework and the mechanism for doing that? So that would be one question. And then the other kind of larger question about ownership and privacy issues is, you know, I'd like to ask Liz for her opinion as to, you know, the state of the law versus the state of the technology. Mm-hmm. And is the law still catching up to the technology? I mean, we're all familiar with, you know, signing a bunch of HIPAA disclaimers, and, you know, there's a lot of procedure that's in place. Is it actually effective at meeting its intended purposes? And in terms of, you know, the various states that have various state laws on privacy, and, you know, the federal government and the European Union, Liz, who do you really think is kind of out in front in terms of leading the law and shaping it to, you know, meet the demands of technology?
Yeah, so let me talk about the first point. Ownership of data is so we could almost do an hour on this topic. It is one of my favorite topics because I love to hear folks talk about business people. I own this data, we own this data. And it's a great philosophical question, because the question is, who really does own the data? Can we own the data? I often say companies can't really own the data, right? It's again, right, that source of the data. It's the patient, right? In healthcare generally. It could even be, honestly, some of what's out there could actually be data that's owned by the physicians, right? The clinicians, the implanting physicians. But generally speaking, companies, in my opinion, don't own the data. They can be controllers of the data. They can have legal duties related to the data. They can have contractual, right? So you can have contractual, so you can have between businesses, you can have contractual duties and responsibilities related to the data. But ultimately, these privacy laws are really pushing us to say, yes, but ultimately we have a duty of accountability and transparency to whom we're collecting the data from, namely our patients and sometimes our employees and from our physicians. So I think that's my quick answer to the first point. The second one is, who do I think is doing privacy well? Certainly, the EU has been sort of leading the charge from related to GDPR, and what you're starting to see globally is quite a few countries are taking GDPR, not changing a whole lot and and are just adopting it. So you're starting to see that in countries like Singapore and certainly India to a certain extent. We have Turkey that has a law that's quite close to the GDPR. Brazil just had new laws. And certainly the challenge becomes as you're trying to manage, right, because there's no consistent approach. You have sort of countries that have real stringent approaches and less stringent. And so a lot of times you're forced to choose, it's a risk-based decision, but to choose the more stringent laws that apply. And certainly GDPR is on the top of the list. Historically, we would have said US is less stringent and not as many laws. But again, what's becoming really interesting, so I think the last point, given we have healthcare companies on the line, is to remember this, right? From a US perspective, HIPAA is a well-established law. It has been around for a long time, right? It applies to covered entities and business associates. It's a well-established law. What's interesting about CCPA in California says that, right, if the data is subject to another regulation such as HIPAA, right, then CCPA doesn't apply. So again, where I was emphasizing understanding the source of your data and what laws apply, it's because you have to start to make an analysis of, do you want to live in the world of HIPAA? Do you want to live in the world of CCPA and in the world of the sort of the, are you going to treat the data as consumer data, in which case you're more likely to live in the world of CCPA and the state breach laws? And that's a super complicated analysis. Who do I don't know. We're starting to see new state laws pop up, and it's becoming, compliance is really complicated and time consuming. And I think it's not realistic to think that you're necessarily going to be sort of, you kind of have to have a more strategic approach to compliance. So I guess that would be my general answer. Certainly GDPR is the most robust.
So we're down to, thanks, Liz. We're down to a couple minutes, and I think Suneel was, I guess, also going to ask maybe, what are some practical tips for startups, but I think we probably are out of time for that answer. So maybe we can collect those from you separately, Liz, and we'll circulate them to the attendees. There was one other question that did come in pertaining to, what's the practical reality of this California proposal to have a data dividend? And Manjeet has promised to get an answer to that, and we'll circulate that back to the person that asked that. And then also books, resources, websites, experts to talk to. If any of the panelists have information about that, if you could provide it to Michelle, and then we can circulate it to the attendees. And Suneel, did you have any last comments that you wanted to make before we bring this to a conclusion?
No, I think we're out of time. I think that it's been a great session, and I just would like to thank our panelists who have a wealth of expertise in this area, and hopefully our guests were useful and provided some useful information to the attendees. So thank you so much for participating today.
Awesome, and ditto from me. And so I guess with that, Michelle, did you have any last comments before to close out the program?
Sure, thanks, Steve. So the next episode of our series will take place on Thursday, November 5th, and it will cover data monetization in manufacturing, industrial, and B2B markets. So if you have colleagues who would be interested, please do let them know, and we would love to see everybody back. So thanks again for joining us, and be well.
Thanks, everybody. Bye-bye.
Thank you.